across MIT, women, students, staff, and faculty have done so much to make it work for the MIT community over the past year. My hat is off to all of them. But there's one woman who absolutely stands out for the weight of her responsibility and the magnitude of her contribution to keeping the MIT community safe, Dr. Cecilia Stuopis. In her role as medical director, Dr. Stuopis provides strategic and clinical leadership for all MIT medical services, including primary and specialty care, ancillary services, community wellness, student mental health and counseling, and campus public health. Prior to coming to MIT, Dr. Stuopis served as the Vice President and ACO Executive Medical Director of Dartmouth-Hitchcock in New Hampshire, and served as the Chair for the Department of Obstetrics and Gynecology, Nashua Division, for 11 years. She holds a Master of Science in Healthcare Delivery Science from Dartmouth College and holds a Medical Doctorate from the University of Nevada School of Medicine. Dr. Stuopis is proudly, I might say, also an MIT alumna, having earned her Bachelor of Science in Aeronautics and Astronautics. I don't think that Dr. Stuopis's contribution to MIT's successful management of the pandemic can be overstated. Over the past 15 months, and as the Institute plans to resume normal operations in the fall, I, for one, am assured by the fact that Dr. Stuopis brings not only the expertise, but the commitment to keeping the MIT community safe and thriving. I am honored that we have Dr. Stuopis as today's keynote speaker.
Mary Jane, you're very kind, thank you. And I'm happy to meet with you again this year. I participated in, I think, the breakout sessions that were held a little over a year ago, which were very successful, as we saw from some of the charts in the reports earlier. So anyway, thank you. I'm going to go ahead and start sharing my screen and my talk. Just give me a moment to get that up. And you can go ahead and put questions in the chat if you like, and I'll try and get to them. I've become pretty adept at keeping track of it, although it's sometimes hard when you're in presenter mode. Let me go back to the beginning. There we go. All right, so I think we have all been living in this pandemic world for well over a year now, and we've heard the word unprecedented a lot. And it truly has been an unprecedented time for us as humans, certainly for MIT as an organization. And we were no exception in the impacts of this pandemic upon MIT. And overnight, we saw radical changes at MIT on how we learned, how we taught, how we researched, how we worked. On March 10th of 2020, MIT made the very difficult decision based on what we were seeing in the public health arena to send our students home, move them off of campus and send them home. 2 days later, all of our non-essential employees were sent home, and many of them, including some folks here on this call, have not returned since then. March 14th, we ramped down our entire research operation with very few exceptions. And I think that was something for me when I knew that this was going to be unprecedented. I never in a million years thought that MIT would completely ramp down its research operation. At the same time, just up the street, I think, from us, and we heard from Moderna last year at this meeting, they were starting their clinical trials of the vaccine. And that was through technology that was developed in part at MIT. Professor Philip Sharp was engaged in some of this work, received a Nobel Prize for that. And really, MIT has navigated admirably through this unprecedented time. So where we are now, some 15 months later, we know from our internal data that roughly 92% of those who've been accessing campus through our campus access program are fully vaccinated. And that is remarkable in terms of the uptake of the vaccine. And we are very proud of those numbers. And we think that part of that is because of the work that we have done as a community to keep folks safe and to keep them engaged and to keep them educated. That has been done through teamwork. Getting to that number is the result of an incredible amount of teamwork. And As you could imagine, MIT Medical was really the hub of MIT's coordinated response on the public health front. But we weren't doing that alone. We were doing that with campus partnerships with organizations throughout MIT and being in very constant and deep communication with our MIT leaders at all levels. And that really helped us, I think, to navigate this pandemic very well. This is a list of some of our notable partners, both on campus and outside of campus. Emergency management, formerly really involved in should we be open or closed if there's a big snowstorm. I think that is, when we were thinking about emergency management, or if there was a chemical spill in a facility. But emergency management under the leadership of Suzanne Blake, an amazing emergency manager who has really helped us navigate this crisis, and really facilitated the development and distribution of every aspect of our COVID-19 policies. The Division of Student Life, that their work under the leadership of Dean Susie Nelson and Chancellor Cynthia Barnhart, they have done everything needed to keep students supported, feeling safe, including managing their housing needs, financial needs, quarantine needs, and really investing in the kinds of supports that they would need. Our IS&T partners, under the leadership of another MIT alum, Mark Silas, they've built a best-in-class attestation and a monitoring system for us across campus, where we can now access our buildings through this app. We attest through this app. This is how our testing is navigated, how vaccines have been managed, how travel has been managed through the course of the pandemic. I joke with them, they would be like right up there with being able to actually develop a manageable electronic health record that could be used by clinicians, because they have been such great partners in this. Our facilities team, they've evaluated HVAC in every classroom on campus to make sure it was safe to bring students back this last academic year that we just concluded, as well as many other spaces on campus, residence halls, for example. They helped to set our occupancy limits for spaces. They installed signage across campus, plexiglass in more places that you would care to know. And then they helped us, importantly for MIT Medical, our testing locations were really critically helped by them. We partnered with the city of Cambridge in terms of providing, we had an ongoing partnership with their Department of Public Health, but we also at MIT provided housing over last summer for their first responders should they need to be quarantined after having been exposed. We donated personal protective equipment in large numbers to the city of Cambridge to help both their first responders and to help local hospitals. And the Broad Institute, our testing partner, as we got started last year, they came to us to help them get a testing lab up. And very quickly, that testing lab is performing nearly, something like 70% of all COVID-19 tests that were performed in the Commonwealth very quickly. So with those partnerships, I wanted to talk to you a little bit about testing, because this has been really a key foundational piece for our program. And it's really about utilizing, what we had available to us. We suspected from the outset that testing would be the way to help MIT get back to its educational and research missions. We started off with as illustrated here, the deep nasopharyngeal swab, and only on a clinical basis, because early on those tests were very scarce. You had to send them to the CDC. There was not really testing available. As we got engaged with the Broad and their testing lab, it became a possibility for us to be able to offer testing to members of the MIT community. And, this was early on the only way. We were interested in seeing what was the level of prevalence of virus in our community starting last March and April, in the weeks after we had sent pretty much most people home, but we still had a sizable on-campus population. And so to do that, senior leadership would allow MIT Medical to do testing if we conducted a research project. So we had a CUI's approved research project, which is not normally in the sort of the armament of MIT Medical is to conduct research projects, but if it was going to take a research project, we did a research project. And we did that in a very collaborative fashion with our partners over at IMES, the Institute for Medical and Engineering Science, to help us get that off the ground. Once we got that test approved, that study approved, We then went on to testing. We had very humble beginnings for large scale testing. We were so excited when in the first day that we opened up testing in gale force rains and winds and cold weather in April, around April 1st of last year, we tested 200 people, and we thought that was like the best thing ever. I see Mary Jane smiling at me on that. Very quickly after the bad weather we had last spring, we realized that the tent was not going to cut it, right? So our facilities partners got us some trailers, some construction trailers, a 60-foot trailer and a 30-foot trailer. And you can see here, this is the smaller trailer here, but we have kitted out the bigger trailer, which is down the way from here, just going along the side of MIT Medical between it and the media lab, that we have a whole system where an individual comes in and will check in at A or B with just a barcode on their phone. We have, it's kind of like you're shopping at TJ Maxx, where they are like, register number 2, like that, the light goes on and you go down to register number 2. It takes seconds. And it's kept everyone very safe. We have swabbers behind plexiglass. There's a very high-tech HVAC system to circulate the air. It's been wonderful. And it's sophisticated. We've talked to so many folks about this, this setup that we have. And we're going to be sad to see it go, but luckily it is going to be going. We also worked with mechanical engineering, Professor Marty Culpepper, on the design and implementation of this as well, I would say. And there's minimal PPE that's required there. So when we were very concerned about PPE shortages, this was key to our strategy to make sure we didn't have to burn through a lot of PPE to conduct testing. And in June, we ramped up. So about a year ago, we ramped up to welcome some researchers back to campus. And we were, again, excited at that time on June 15th that we could do testing for up to at least 3,000 people coming back to campus. And by August, we were welcoming even more people back as the first semester of last fall began. And we had a wait time of 1 hour, and that certainly wasn't acceptable. You can see folks were lining up all the way down through North Court to come and get their test. And this is just an example of how we scaled up to meet the needs of our campus and pivoted very quickly to understand and improve our operations to meet the needs of the community. And testing was key. There were many members of our community who would not set foot on campus unless there was some kind of assurance that they were being tested and the people around them were being tested. So now, where we are now, this is a screenshot of the app. Tim the Beaver is getting a test. He can see his negative testing history. He can see how long it takes to get a test at one of the various locations on campus that we had set up. And right now, I would say, it says here 10 minutes. I think it's under 5 minutes. It takes longer to walk into wherever you're testing than it takes to actually get the test. And that is our new normal. And what that means is that, on any given day, we are testing thousands and thousands of individuals right now. And part of this was made possible. We had to move beyond the trailer once we welcomed more people back to campus because the trailer just didn't have the throughput. So we, again, pivoted and collaborated with our partners in DAPR. And the Johnson Athletic Center seen here, we call it the hardest working building at MIT during the pandemic. Right now, in this photo, you see it set up as our testing center. In the back are the testing booths. There's usually an observer positioned here who can look through one of 3 booths and directly see the person swabbing their nose, and they're self-swabbing. Then the individual will leave the testing station, walk back around, drop their specimen tube here, get some hand sanitizer, and walk out the back door of the Johnson Center. Their test takes seconds to complete at this point. We also configured the Johnson Testing Center in April of last year to be, prior to it becoming a testing center, it was a field hospital. Should there be a surge in Cambridge and we had a surge of MIT individuals who were sick with COVID that did not need to be in a hospital but could not be in a dorm room, we had a place for them to go. And our testing facility. And so with these multiple booths that I just described to you, we can test on campus we've tested just under 7,000 people in one day. And if you can imagine, At one point earlier on in the pandemic, we were testing more people at MIT than, pretty much any healthcare facility around us. And we were doing a sizable proportion of all of the tests that were being conducted in the Commonwealth at that time. And the game changer for us was the ability to move to the self-swabbing and not having to have a trained medical professional conducting the test. We think we could do up to 10,000 tests a day here, and we've not had to do that, but thankfully, and hopefully we'll not have to do that in the future, but we can put a lot of people through this facility. We've also used Johnson as the location for our flu clinic. We wanted to protect against what some call the twindemic. We did not want to have a large flu season either. So we provided flu shots there. You can see the team ready to go. People could come in and get their COVID pass test done, and then they could circle back around and go get a flu shot, or in the other order. That was a great thing that we were able to do. And then I think finally, and this was really one of the biggest disappointments, I would say, for me and my team in part of the pandemic, was really our inability to secure vaccine that we could use we could have on site to administer to our patients. So we started off administering vaccine relatively early as a doctor's office or a healthcare facility to administer it to our healthcare facility and first responder employees. And then after that, the Commonwealth pivoted to the large vaccination sites, which meant that organizations like MIT Medical were no longer able to get the vaccine, to distribute. We at one point, had announced that we were an approved distribution site, and we were, and unfortunately, we just could not get the vaccine. But just last month, we were able to get some vaccine, and we are proud to say that we were able to vaccinate several thousand in our community altogether through that effort. All right. Let's see. So the other part of our effort at MIT Medical that I wanted to talk to you about that we're very proud of, and I think is actually even more important in some ways than the testing aspects and of course the other public health aspects of monitoring the pandemic, is none of this would have been possible without excellent communication. And that has been a big learning for us. We couldn't just tell people to stay home and stay safe. Our MIT community is very interested and engaged, and they had a lot of questions. Our number one job was to keep them informed as to what was happening on campus, but also how to keep themselves safe in their regular life. So we really doubled down on the types of health communication that we were putting out at MIT Medical. The pressure was on for us to be able to provide timely answers to the thousands of questions that we received. Here you'll see the course of the pandemic in terms of case counts, and you'd see what happened to our personal page. People were really hungry for information, and it was important for us to answer those questions. And we did that in a way that we thought made sense for how we traditionally had communicated with the MIT community. And that was through a series of blog posts and a Q&A that's sort of an ongoing Q&A, coupled with engaging types of illustrations and social media posts. We did extensive research on every single one of 120 detailed responses to commonly asked questions. And they covered things like mask quality, how the COVID-19 tests work, how do you get COVID, the origins of the variants, how to safely protest. That was a big one last summer, and many, many more. And I encourage you to go take a look at some of these posts if you're interested. We've gotten thousands of questions from the MIT community and from people who aren't even part of the MIT community, but happen to stumble upon our content. And we know that as time has gone on, the questions have changed. Very early on, the questions were very much geared around how do we keep ourselves safe? And then it became more like, how can I go out and do more things safely? And I think we've been able to answer both of those types of questions quite ably. The content produced by our team at MIT Medical has gone gone viral, actually. This illustration that you see here is one that really struck home with a lot of folks, was shared widely on social media. And this was really around, how do you know if you are at risk of getting COVID-19? And it was translated into multiple different languages in multiple different countries. And, our work was quoted in the Washington Post and the LA Times and referenced there. And the traffic to our website has been, massively increased, and page views were up more than 950%, which is pretty impressive. We need to do other kinds of communications too, that couldn't just be this sort of passive, communications also. So in partnership with our larger MIT, you'll see here on the left, there's a screenshot of a Zoom town hall, one of the many Zoom town halls that I have participated in, along with other esteemed senior leaders at MIT. That has been a major vehicle for communication to the MIT community. We've had town halls for employees, we've had town halls for staff, we've had for other types of staff, we've had town halls for Lincoln Lab, we've had town halls for students. We've even had ones where parents could engage in. And these forums have been really wonderful in terms of being able to provide some presentation about where we are going next, but also to answer questions live in real time and allay fears about COVID-19. As a doctor's office, we also had to provide that kind of communication to our patients. So we spun up a patient newsletter that was sent out to patients every week. And it talked a lot about what was going on in our clinic in terms of how patients would access care, what kinds of things they should be thinking about, and providing them with lists of resources. Both of those have been very widely well received. And we're going to continue some of these. I think, certainly the patient newsletter is something that will continue. And I suspect the Zoom town hall form of communication will also be leveraged to communicate about other things besides COVID in the future. Right now, our work is focusing on combating hesitancy, which, as you know, the vaccination rates, while were very, there were steady increases in vaccination over much of the spring as more age groups became eligible. That has plateaued out. And one of the reasons there is that the folks who remain unvaccinated right now, it's not because they don't have access to vaccine, it's because they are concerned about taking the vaccine. So much of our work right now is in the space of how do we help people answer questions in a scientifically based way that reassures them that the vaccines are safe and effective, and hopefully gets them to have that make that appointment or walk into that CVS, or at least talk to their own personal doctor about it. And again, we've done this through a series of both blog posts, but also social media type of methodologies. And then most recently, actually in this last couple of weeks, members on my team, clinicians, have gone out to small group meetings in person in socially distant classrooms to talk to some of our third shift workers and folks who are in the unions who we believe have higher rates of hesitancy, to meet with them in person, share information, and answer questions. And all of this is an effort to combat hesitancy. So as of today, we've given 2,685 vaccine doses at MIT. We're very proud of that. We've only given Moderna, and that's because that's all that we have been given. Down on the bottom right here on this screen, you see Fatima Rosario. She is the lead housekeeper at MIT Medical. She was front and center for keeping our facility clean, safe, disinfected, as well as those testing trailers, all of it. And she was the first recipient of a vaccine that was administered at MIT. And it was really telling that she was the person who should get it, because she was putting herself. She was not in one of those jobs that could be done remotely, for example, as a lead housekeeper. So it was important to us to protect her. And we are continuing to encourage all members of our community to protect themselves from COVID-19. And that is, what we're doing now. We're at the light at the end of the tunnel, I believe. Our campus policies for the fall have been coming out over the course of these last couple of months. Many of you will know that we have made a requirement for students to be vaccinated. And just 2 weeks ago, we announced a requirement for other staff and employees and faculty to be vaccinated. And that is something that we are moving forward with. This is at the same time that we're lifting many of the other COVID era restrictions that we've had in place around density and distancing, what have you. We will also continue to use testing as we move into the fall as a sort of a stopgap measure, because we know that there are many in our community who cannot be vaccinated for health reasons, is number one, but also we have children who live on our campus in various parts of the housing supply, and they are not eligible to be vaccinated yet. So we are very motivated to keep them protected. This has been a really wonderful time for MIT to know that it can do very hard things. It can do them quickly, which I think was reassuring to me. There's a lot of bureaucracy at a place like MIT, but when push came to shove, things got done, and I think they got done for the benefit of the MIT community, for our students, for our faculty, for our staff, and really for anyone who who is part of the MIT community. And we are looking forward to that time when we are all going to be back together on campus. Many of us will be there as we were before. Some of us have learned that working remotely is going to be part of our future, and we're excited and ready to engage again. And that's going to be one of the major roles for MIT Medical this fall, is to again making sure that we are helping our folks who are coming back to campus to feel that they are safe, and doing everything we can to keep it that way. So I will stop there. I'm going to go ahead and take a look at the chat. I'm going to stop. I do have a set of resources if you want more information. And let me just start with what I see in the chat. So first, a question, who is not MIT on-campus community? So who's not counted are any students or faculty or staff who are fully remote. So there has been a process throughout the course of the pandemic to essentially, it started with essential people at the essential workers were on campus. And then as we have gradually reopened, more people have been added to what we call COVID Pass. And that is the on-campus community. So people who are fully remote are not counted in that number, that 92% number. And that was a great question. Thank you. Proportion of students who have antibodies. So we are not measuring antibodies at MIT in any way, shape, or form. It is an even more expensive venture than it is to do testing, and we have not felt that would be lend enough useful information to us. So if folks are vaccinated and we have proof of that vaccination, we are accepting that. People who have had COVID-19, they're also recommended by the CDC and other health organizations to get a COVID vaccine as well. So we are not checking antibodies on anyone within our community. And then for the non-vaccinated folks, because of our requirements now, they will become vaccinated unless they have a medical or religious exemption. And that will be something that we're working on this summer. The deadline for the vaccination requirement is July 30th. So folks who remain unvaccinated still have some time for that. Karen asked a question about the breakdown of where the questions were coming from. Karen, they came from all of those groups. I would say many from staff, less questions from faculty, but also many from students, and then the oddball one from outside the community who had stumbled across some of our content. How do we staff this? This is a really great question. So, our staffing model for the testing enterprise, for example, we started off when we had the tents at the very beginning with using our own internal staff, because our clinical services were greatly reduced during that time frame, so we could repurpose them into the testing area. But as we started welcoming people back to campus starting in June and then more robustly back in August, it was clear that our internal staff couldn't do that because we were having patients come back as well to the clinic. And so what that meant was we have engaged a temporary workforce to do this work for us. So a lot of nursing students, for example, from local area colleges, we hired on as temps to do this work and conduct the testing. And that was, I think, critical in being able to do that successfully. So that's how we have managed that part. is largely through a temporary workforce. And actually for MIT Medical, one of the interesting things out of that is we've identified some folks in that temporary workforce that we have subsequently hired into our permanent workforce. So it's been a wonderful way for us to actually find new folks for our team at MIT Medical. There's a question about vaccine refusal amongst MIT personnel and students, et cetera. So we don't have those numbers. Those numbers aren't up yet because the deadline is not until July 30th. So we'll know more about that come August. Our initial understanding is there have not been very many requests for exemptions from either students or from staff. So that is, I think, very reassuring to us. And then there's a question about when does normal return to MIT? I think we are going to have some measures in place for the fall. And really, I feel very strongly about this. You know, we're enjoying right now very low rates of infection. We have not had a positive test at MIT for a couple of weeks now. That's all wonderful. It's not dissimilar to how things looked last summer because there's seasonality with COVID-19 as well as the whole group of coronaviruses. So we expect that there will be some sort of a resurgence amongst unvaccinated populations come middle to late fall. And for that reason, we will be continuing with doing some testing. It will be at a much decreased cadence than what we had done during the course of this last academic year. Most people who were on campus regularly were tested twice a week, and people who were there less frequently were tested once a week. We'll be doing less than that this fall, but it will start to feel more normal. Our residence halls will be fully populated this fall and actually are oversubscribed, it sounds like. So we'll be back to the era of forced triples and quads, I think it sounds like. And, you know, our research enterprise is fully coming back starting this summer. So, you know, campus will look and feel much more normal. Masks, I think, will be moving to more of an optional type of situation. But we are going to be closely observant. We do not want to, you know, have any clusters of cases on campus come fall. But I am worried about the fall when the seasonality comes into play. And then, of course, the variants are something that we also have to be concerned with. And then there's a question about mental health challenges. So, you know, that we know has been an issue for our students for sure. The isolation that has been bred out of the COVID-19 pandemic has kept our student mental health and counseling team very, very busy. We see it also on the staff side of things. And we know that through the numbers that we see from our employee assistance program called My Life Services, that the utilization of their services for mental health issues is up as well. So we are working to partner with you know, them and other colleagues to understand how best to help the community as they return to campus. I think that's going to be the large part of our work coming in the coming year. We know there will still be a lot of anxiety for people coming back to these more densely populated situations on campus, and we have to work to manage that. Self-swabbing. There's a question from Karen about, does it always work? Yes, it works, I think, very well, particularly because it's just the lower part of the nose, so just like your nostril. And we have observers who have been watching it while folks were self-swabbing. We're probably going to unobserved self-swabbing as we move into the middle to late summer. And it works very well. Our invalid rate off of the self-swabs is in the order of around 1%, give or take. And that can be for a variety of reasons, but people got very good at swabbing very quickly. So when can a vaccinated alum get on campus? So, you know, visitors are going to be welcome back on campus starting in the fall. As best of my knowledge, though, again, that information is coming out, but there will still be some restrictions in terms of how people can access campus. But I think for, you know, and we're not gonna differentiate vaccinated versus unvaccinated. That's an important distinction that we have made. As you have a higher proportion of vaccinated people in your population, the COVID-19 infections actually start to occur in them just as much as they occur in the unvaccinated group. So we felt that we wanted to treat everyone the same. And for that reason, we will be testing everyone, not just the unvaccinated, to get to Janice's question. And I think we have one more question, which is the libraries. I have a question about the libraries, and that is, when are they going to open? I believe they will be open in the fall, is my understanding, but I have not heard specifically about the vaccines. And then lastly, I think it's important for me to answer the question from Margaret Jones about members of the MIT research community who have concerns about neurologic problems caused by mRNA vaccines. I will say that I do not ascribe to that form of that opinion. I do believe it is opinion. I don't believe it is fact or scientifically evidence-based data. You know, if you look at through the history of time, of all the wonderful things that have happened in medical interventions, vaccines have saved more lives than any other medical invention, any medicine, any surgery, anything. Vaccines are the way to go. So I have received the Moderna vaccine. My whole entire staff has received the Moderna vaccine, and you know, they are all excellent vaccines, and I highly encourage you to get vaccinated if you are not yet vaccinated, and to, if you have questions, to ask your doctor about it. So thank you very much.
Thank you so much, Cecilia, for not just this great presentation, but for all the work that you have done over the past year as a personal beneficiary, and that I work on campus and that I'm a mother of a student. I personally want to thank you, and on behalf of the entire MIT community. I can't imagine what it must have been like. So we will, in light of respect of everyone's schedules, just move directly to the toast. We will figure out other opportunities to socialize in the over the summer. But I would like everyone to raise a glass of something. And as we look back over the past year, many of us have faced challenges that we couldn't have imagined a short time ago. And MIT women everywhere have risen to the occasion of this global pandemic in so many different ways, on the home front and professionally. And I'd like to raise a glass to all of our MIT sisters across the world. Here.
Here, here.
So thank you all for joining us. And I want to reassure everyone that we have heard your concerns about participation, and that we will get back to the membership with additional information about the process, clarity about the process and timeline moving forward. So thank you all, and we wish you a good weekend, and until we see you next. Thank you for coming.